Hi everyone, today let's talk about how bright your teeth should be if you're thinking of getting veneers, if you're thinking of getting implants, all on four, whatever it is, any kind of cosmetic dental treatment which is going to enhance your smile, you'll probably get an option to choose the color of your teeth. Now, depending on what you're after, are you looking for a natural smile, a lived-in smile, a Hollywood smile, or even a turkey smile? What's possible? What are the differences in terms of color? Now, there's a lot of changes between all of these kind of styles of smiles. We've got the position of the teeth, the size of the teeth, the kind of the gaps in between the teeth, all this kind of stuff. These are all variables, and color is just one ingredient in this whole mix which is going to help us deliver the end result. But let's take a deep dive into it today. So grab yourself a coffee and let's geek out about color. So when patients come and see us, often there's two situations which we see typically. Number one is we're doing everything. We're in some way or form, we're completely redesigning the smile, whether it be on implants or on natural teeth where we do veneers. We have a complete choice of what color we're going to use. And we don't need to match it to anything. Whereas the other kind of scenario is where we have only a certain number of teeth which we're doing. And in these situations, we have to respect the natural color of the patient's teeth. Now, this is a dental shade guide. Okay, and hopefully you can see this with the lighting. And what we've got here is a whole section of numbers and letters. Okay, so we've got A1 to A4. Okay, we've got an A3.5 there. We've got B1 to B4 and C1 to C3, C4, and then D2, I don't know why there isn't a D1, to D4. Now these are categorized in kind of hues, okay, in colors. So the A1 is kind of a reddish brown color. Then the B's are a reddish yellow color. The C's are grayish, and then the D's are reddish grey. So when we give our patients one of these, immediately what they say is they can't really tell the difference between all of the colours, okay? It's not that dramatic a difference. And that's because getting one of these is like getting a sample paint for when you're painting your house. You know, you put a little sample on the wall and think, oh yeah, that looks great, but when your whole thing is done, it looks different. And that's why these tiny little shade variations actually are quite a big difference when you're looking at a full smile. So even though we've got our colors in the blocks, okay, so A's, the B's, the C's, the number relates to how bright that kind of tone is. Okay, so when we look at color, we've got the actual color itself, and then we've got the brightness associated with it as well. So 1 is the brightest, whereas 4 is the darkest. So actually, this is not the best way to order this shade guide. Okay, let's figure this out and put this in a better order. So now what I've done is I've ordered everything from the darkest to the lightest, and you can see that B1 is the lightest of all of these shades. Then we've got A1, and if we were to take a black and white photo of this, then it would be really obvious that we've just gone from light to dark, ignoring the actual color that is involved. And this is probably a more useful way of doing this. Now, most people, before they've had any teeth whitening done or anything like that, are kind of like in this ballpark, somewhere between the A3.5 and the A3. And if you just have normal teeth whitening, you're probably going to end up in that color. And just for reference, most of the veneers that we do are this color, or we have some even whiter shades here, or they're that color. Okay, I'd say 80% of the veneers and maybe even all-on-fours that we do are this kind of color. All-on-fours, because it's usually an older kind of population, we go a little bit darker sometimes. But if we're going for absolute natural, we should be going down here somewhere. We've also got shade tab full of gums, okay, and this is really for those people considering all on four where we have to replace the gum as well as the teeth. Now, even though the shades on this shade tab look pretty extreme, we have had patients having work done abroad, and maybe we need to kind of match that color, and we really struggle, our labs really do struggle with the ceramics of matching that kind of teeth shade. Now, the truth is that for some people, one shade, so let's look at this bright bleaching shade. If we go for quite a white color on here, this will look good for some people, but it would look really odd on other people, because what we need to think about is kind of relative color. What does our eye perceive? And really the easiest way to think about this is contrast. So if you have somebody who has very fair features, fair skin, then a lighter color is not that big a contrast. So what I typically tell patients in that situation is that they can get away with a brighter, whiter color. Now, if we've got somebody who's got darker skin or maybe a dark beard around the, framing the smile, and we use the same color, this color is going to appear much brighter in that scenario. So it's going to start bordering on unnatural. Now, some people are looking for that look, which is absolutely fine, but some people want a bit more of a subtle look. And that kind of contrast is probably a little bit too much. We also need to think about how much tooth is actually on show. So as we get older, we show less and less top teeth. So we can potentially go and maintain a nice white color, but because we're not showing so much, it's not going to be so in your face. And also the tooth shape, if we've got rounder tooth compared to a more square tooth, in the smile zone, on a square tooth, there's more tooth visible, so there's going to be more white and it's going to pop more. Now we're getting a little bit into tooth shape, and this video is really more about tooth color, but it's about the perception of color. And people with kind of blockier white teeth, well, blockier teeth, their teeth will look whiter even though their shade may not be particularly white. And this is just because you can see more tooth in that scenario. A kind of an extreme way to visualize this is somebody who has had kind of all-on-4 treatment. So they've got very few of their own teeth remaining. And this particular gentleman, he didn't have a denture or anything like that. He was just walking around with a few teeth, and we gave him temporary teeth. Now the temporary teeth are not particularly white. They're definitely not on this scale. They're over there somewhere. And just because we can see so much more teeth in the smile, that's why everything is just looks brighter. So now let's look at a natural look smile and a Hollywood smile and kind of like an extreme white smile. And these are the typical smiles that we see when people go abroad to have their work done and then come back. It's much harder to create a natural looking smile. Okay, and this is because of the complex ways that light will interact with the teeth and kind of bounce back, and then the person who's seeing that smile, that's what they're going to see. Now, to a non-dentist and a non-geek, all we're going to think is, oh, those teeth are too white, or those teeth are dark, or something doesn't look right, but we're going to categorize it in kind of these broad terminologies. So let's jump to the computer and let's see what actually happens when light hits a tooth. Okay, so let's start by drawing a tooth. Okay, and this is inside the tooth, and inside the tooth we've got a nerve that runs like that, and then we've actually got two layers of kind of tooth. Okay, so this here, okay, that's the enamel. Okay, and I'm trying not to crowd myself too much. Okay, this is the dentine. Okay, now these have different kind of color properties to them. So if we've got light that is hitting the surface of our tooth like that, some of it is going to bounce back here. Okay, so this is going to look pretty white. And this is going to have like the surface reflections on there. So enamel of a tooth is typically quite bright and quite white. Now, some of this light is going to go deeper and is going to bounce off the kind of the dentine of the tooth. Now the dentine is much darker, so this is more yellow. So where we were looking at the shade guide and it had all those tints really relate to the color of the dentine, and that's what's different in certain people. And the thickness of the enamel as well. So if the thickness of the enamel, if the tooth is nice and thick, then you've got more white that's going to be on show, whereas if the enamel is thin, it's going to look yellower and darker. So as we get older, we actually lose some enamel off the surface of our teeth. This is one reason why they can appear a little bit darker. Okay, and then inside we have this nerve, okay, and again, the nerve is much less important in most cases, but it adds that redness to the inside. And what we end up with is depth of color. Okay, it's not just one color, it's a complex relationship of different colors, and in different lighting, some aspects are going to be more accentuated than others. Oh, and I forgot to even say, some of this light is going to pass straight through, okay? That's going to leave a kind of a darker area. It's typically at the tip of the tooth when the tooth is really thin, and this is called translucency. This is a little blue layer inside the tooth, or a little blue tint at the bottom of a tooth. It's much more typical in older teeth, and when we're doing veneers, even though we can add this stuff in, we never do because patients are always like, oh, what's that little dark spot? You know, we don't realize that teeth have such a complicated color when in reality they honestly do. But when we have a veneer, we're literally covering the front surface of the tooth. And what our lab technicians then need to do is really build in artistry. They need to kind of mimic, by putting surface stains on the top of the tooth, what does a natural tooth actually look like? Now, when we're doing a full smile, this is quite easy because our patient's perception of what a natural tooth looks like is one of these colors. Now, we typically don't make it a solid block color. It really does look unnatural. We try to add a little bit of warmth at the neck, but that's pretty much as far as we go. But when we need to do, say, a single front tooth where we've got complex areas of light and dark and things like that, we need to make it look symmetrical to the other side. If we just used a block color, that starts looking really weird. So that's where the skill of the technician comes in. Now, I think, you know, just like dentists, some technicians are de-skilling just because of the advent of computer technology, and it's rare that somebody needs to put the attention to detail in to making the final restoration. Luckily I've got a technician who is as passionate about this stuff as we are here, so we're typically able to get nice natural looking results. However, we can't do it first time. When you're having a front tooth done, for example, quite often we'll have a try-in appointment to make sure that the shades kind of match and see where the differences are, because even though we're taking photos and we're sending them and we're taking shade measurements, the reality is it's impossible to get the exact color measurements because of so many variables, like the lighting I've got in my room. I've got a window, so the color temperature changes during the day, and you know, you take a photo on one camera, you look at it on one screen. If you look at it on a different computer screen, the colors are going to look different. So it's really difficult communicating the precise color of a tooth to a dental laboratory. But as I say, if we're doing a full smile, it doesn't really matter because we can make everything match, and everything will typically match. However, doing a full smile has its own challenges. If we look at something like this is an implant that we have to cover up. So even though we've got the same color on the outside, we need to deliberately make things different because we're trying to mask this color. You see, the final color of a veneer is made up of the outer surface, whatever color stainings we put on that, the body of the veneer itself. This comes in all sorts of different colors, and the color of the cement that we use. Okay, we've got different colors of cement to kind of compensate in slight color variations. And then we've got the actual stump of the tooth, okay, what's left. And I'll always send a photo of our stumps, okay, I know it's not the nicest word, but it's called a stump shade photo. We take a photo so the lab gets an idea, oh, hang on, you know what, this tooth is really, really dark, so we're gonna have to cover this one up. Now, if you look at most of my before and after photos on Instagram, a lot of people will say, oh, you know what, it looks a little bit bright, it looks a little bit unnatural. Now, this is true. I think the photos on my social media are brighter than what they look like in real life, and this is because we use kind of high intensity flashes on the teeth. Now, I'm a geek when it comes to photography as well. Okay, I absolutely love photography, and I could reduce this if I had kind of large soft boxes, but they're bulky, and we just need to, oh, well, I need to make a compromise on the size of my camera gear just so I can use it day to day and it doesn't get in my way. So this particular lighting creates a bit more of a hard light, which can make the reflections a little bit more kind of aggressive. And this is why I think the Hollywood look is the Hollywood look, because they're under a lot of studio lighting in a lot of cases, and that can kind of emphasize the reflections, the surface reflections on the teeth, making them look brighter. Now, in reality, the light is often coming from above, natural day sunlight or lights are usually on the ceiling. And this creates a natural shadow. So our lips create the shadow. If I'm taking a photo straight on from the front, we've lost all of our shadows and we've improved our highlights, making the smile look brighter. So next time you're in front of the mirror analyzing your smile, remember that, it may not look like that in day-to-day life just because of the angle of your bathroom mirror and your lights. It's much more of a direct angle. Another thing that factors the appearance of how white your teeth is the texture, and we've hardly even discussed this. This is the surface roughness of a tooth. If you have a tooth which is perfectly smooth, light's going to hit it and bounce straight off. It actually makes the tooth look a little bit darker, whereas if we add a little bit of a roughened surface to the surface of the tooth, what happens is the light hits it and it scatters. Again, this creates a more of a natural look and it improves the brightness of the tooth without changing the actual color of the tooth. Now, taking all of this into account, what color should your teeth be if you're considering this kind of treatment? And the truth is, there's no one size fits all, which is why we've got a whole selection of guides, but there are different colored temporary materials available. So again, usually, just from experience of doing hundreds and hundreds of smiles, there's only a handful of these colors that we actually use day to day. And we've got temporary materials which we can build out to mimic these colors. They don't have the same texture, it's not an exact like for like thing, but it gives us a pretty good idea of what's going on. One thing I would kind of caution against is getting too used to a color. Okay, so quite often we'll put in a bright color as a temporary, the patient would go away and they will come back and think, oh, can I go a little bit lighter? Okay, and that's because you kind of got used to the appearance of the smile. Now, if we do teeth whitening, again, quite a lot of patients will have teeth whitening, they're really happy with the results, and then they'll say, oh, it wore off really quickly. But then we check the color and it's still the same color. The reason for this is we've got used to the color of the new whitened teeth, and we think, oh, let's go a little bit more, okay? And if you've had teeth whitening, your teeth are probably bright enough. So as always, guys, I hope you found this video interesting, and if you stuck with me to the end, excellent, you're a geek like me, and I will see you soon. I'm doing a whole series on kind of the aesthetics of smile design. So I think next, let's talk about the shape of the teeth. Until then, take care.